health stories made headlines across the country and here locally this year. With the year 2015 just a few days away, News 18's Elizabeth Frenchler breaks down the top medical headlines of 2014.
The year began with some 400,000 Hoosiers in healthcare limbo. It was in December of 2013 when IU Health and United Healthcare Insurance struggled to reach a contract agreement. A temporary agreement was eventually reached in early January, but it left many patients like Don Copus unsure about the future.
Not only do we see a number of IU Health doctors, but of course this involves the IU Health Hospital too, so that puts a big whammy on our entire family.
The temporary agreement allowed IU Health to treat United Healthcare patients as in-network, but the patients were still responsible for paying any copay costs.
We know patients value the relationship with their physician and healthcare team, and we want to help them maintain those relationships without unnecessary disruption.
A permanent agreement between the two was eventually reached in February. In April, Tippecanoe County EMS reported a spike in how often they administered Narcan. The drug helps reverse the side effects of an overdose from opioid-based drugs like heroin. In 2013, paramedics administered Narcan 148 times, but just 4 months into the new year, that number had already hit 52.
It has gone up a little bit, but then again, we have seen a pretty significant resurgence of heroin use in the last couple of years too, and they kind of simultaneously go together.
While heroin proved to be a topic of conversation nationwide this year, so did Suboxone. The drug is a synthetic heroin substitute, and in July of this year, the DEA raided 5 offices across central Indiana for illegally selling the drug.
We ran 7 undercovers, 27 undercover visits into this. There was no physical, no blood pressure, no blood work, no anything sort of like that to get these prescriptions.
Dr. Luella Bangura, whose practice was in Lafayette, was involved in the drug ring. While her local office was not part of the sting, investigators say she wrote more than 120 prescriptions for Suboxone a day on several different occasions. Bangura was charged with 4 counts of dealing a controlled substance and 1 count of corrupt business influence. Her trial is set for March 27th of next year. As the summer months approached, the concern over the Ebola virus grew. After several Americans tested positive for the virus, a West Lafayette scientist decided to take action. Dr. Stephen Hall and his colleagues at Pentamere Pharmaceuticals took vaccine technology created by Hall decades earlier and worked to modify it to treat several strains of the virus.
That enables it to carry different regions of the Ebola virus and different regions of different strains of the Ebola virus in one vaccine, which is very unique.
The next step in the vaccine development is to do animal testing. The group is working to raise money to get that started. Ebola wasn't the only virus making headlines this year. In September, enterovirus D6 was hospitalizing children across the country. Here in Lafayette, 3-year-old Eva Walker and her family thought something was suspicious after her flu symptoms got worse.
She seemed stiff but also like limp, dead body weight. And she continued to complain about her neck. Then she stopped talking and really responding to us.
Eva was taken to IU Health Arnett Hospital, where she was diagnosed with enterovirus meningitis. After spending several days in the hospital, she was released. September 3rd marked a day many healthcare workers and community members will always remember. After an announcement in April, the emergency room at Franciscan St. Elizabeth Central Hospital closed its doors. Vice President of Marketing Lisa Decker says it was a move to help save money.
We are challenged every day with making sure that we're running our facilities as efficiently as we can. St. Elizabeth Central is a very old facility, so we've looked at that to try to figure out how we can consolidate that campus and reduce the square footage that we're using over there.
An urgent care facility has since moved into the vacant ER's place. As the holiday season rolled around, doctors began warning parents about the increase in shigellosis cases. This year, numbers have reached more than 1,000 in Indiana. The highly contagious disease is spread from person to person through fecal matter, and doctors say good hygiene is the best way to prevent the spread.
As long as we break that cycle with good hand washing and and keeping kids that are sick at home, and it'll calm down on its own and it should be fine.
That was a look back at the health stories making headlines this year. As we approach the new year, we here at News 18 want to wish you and your family a safe and healthy new year. Elizabeth Rentschler, News 18.